Before we get into this, if I ask you a simple question, is your phone system HIPAA compliant? Would you know the answer? Most practice owners I talk to do not, and the bigger concern is not that they got it wrong. Most of them have been using a non-compliant setup for years without knowing it. Personal phones, landlines, Google Voice, free tools that were never designed for healthcare. None of those are HIPAA compliant. And here is the second mistake I see just as often. A practice owner goes online, searches for the best business phone system, finds a list of names, RingCentral, Nextiva, Dialpad, picks the one with the most features or the lowest price, and finds out 6 months later that none of it actually connects to their EMR. That advice was written for retail businesses, tech companies, and sales teams, not for a front desk managing patient appointments, insurance calls, prescription refill requests, and 40 incoming calls before noon. The criteria that matter for a healthcare practice are completely different. My name is Anmol and I am the co-founder and CEO of Emitrr. We work with more than 2,000 healthcare practices. In this video, I am going to walk you through 5 specific things you need to evaluate before picking a phone system for your practice. And I will also tell you honestly how the major options on the market hold up against each one, including Emitrr, because yes, I am biased, but I will also tell you where we are not the right fit. Let us start with the first and most important criterion, HIPAA compliance. Now, a lot of vendors will tell you they are HIPAA compliant and mean something very vague by that. There are 6 specific things you need to verify, not assume. 1. A signed BAA, a business associate agreement. If a vendor claims to be HIPAA compliant but is not willing to sign a BAA with you, that is a red flag. Do not move forward with that vendor. 2. Encryption, both in transit and at rest. In transit means while your calls and voicemails are moving through the system. At rest means while your recordings, transcriptions, and data are sitting in storage. Both need to be encrypted. 3. Access controls. Not everyone in your practice should have access to every call recording. Your billing team, your front desk, your office manager, they should each have different permission levels. That is what access control means, and it matters when a team member leaves. 4. Audit logs. You should be able to see who accessed what and when. Call recordings, transcriptions, system settings, there should be a full trail. 5. MFA. Multi-factor authentication and workforce device control. If your staff are taking work calls on personal phones, there needs to be a clear line between work and personal calls. Personal phones without this are not HIPAA compliant, full stop. 6. Data deletion on exit. When you stop working with a vendor, every piece of patient data they hold needs to be completely and verifiably deleted. HIPAA requires this. Ask for it explicitly before you sign anything. Those 6 things, BAA, encryption, access controls, audit logs, MFA, and data deletion, are what HIPAA compliance actually means for a phone system, not a checkbox on a pricing page. Second criterion, EMR integration. This is where I see the biggest gap between what vendors promise and what they actually deliver. Most phone systems that claim to integrate with your EMR are connecting through a third-party middleware tool, something like Zapier or a bridge connector. What that means in practice is that the integration is limited, the data sync is often one way, and when the EMR updates, the connector has to keep up. We hear this from customers constantly. They were using RingCentral or Zoom, and the EMR integration just never really worked the way they expected. The conversations did not sync back into the patient chart. The call data sat in the phone system and went nowhere. A native direct integration is a completely different thing. It means calls and texts sync automatically into the patient record. It means when a patient calls, your front desk can see their details on screen before picking up. It means your AI agent can book an appointment directly into the EMR in real time, not send a notification to a human who then has to go do it manually. If a vendor cannot clearly tell you whether their EMR integration is native or goes through middleware, ask them directly. That one question will tell you a lot about what you are actually buying. Third criterion, call handling and missed call automation. Here is a number that should concern most practice owners. On average, across the practices we work with, healthcare offices miss somewhere between 15 and 20% of their incoming calls. That is patients calling to book appointments, reschedule, ask about a prescription, and nobody picking up. When nobody picks up, patients call somewhere else. So when you are evaluating a phone system, ask specifically what happens to a missed call. Because if the answer is voicemail, that is not a good enough answer anymore. What you need is Smart IVR, an interactive voice response system that routes patients to the right team without a human having to transfer them manually. Call queues so patients are not hitting a busy signal during peak hours. Call recording for training and compliance. And ideally an AI agent that handles calls after hours, answers common questions, and can book the appointment directly without anyone on your team being there. Modern practices have moved on from voicemail. If a phone system is not offering you a path to AI-handled missed calls, that is a gap worth thinking about. Fourth criterion, texting and calling in the same platform. This sounds like a small thing. It is not. Most phone systems keep your calling interface and your texting interface in completely separate parts of the product, sometimes behind different logins entirely. For a front desk team that is already managing a waiting room, a ringing phone, and 3 patients asking questions at the same time, jumping between 2 separate tools to check if a patient also sent a text is a real problem. What you want is one unified view. Calls, texts, voicemails, all of it in one place tied to the patient record. Every platform I will mention shortly keeps these in separate interfaces. That is worth knowing before you demo anything. Fifth criterion, support that understands healthcare. I know this one feels obvious, but it matters more than people expect. Your front desk team is not a software engineer. When something is not working at 8 in the morning with a full patient schedule, you need to reach a real person who knows what an EMR is, understands how appointment reminders are supposed to fire, and can resolve the issue quickly. Generic support that takes 2 days to respond is not useful in that moment. When you are comparing platforms, look at the support ratings separately from the product ratings and ask the vendor directly. Is your support team trained on healthcare workflows? Can I call you? The answer to that second question is more revealing than any demo. Now let me walk through how the major options stack up against these 5 things. I will put them in 3 buckets. Bucket 1, RingCentral and Zoom. Both can sign a BAA, so they check the basic compliance box, but their EMR integrations run through third-party connectors. We hear from customers who came from RingCentral that the Athena Health or ECW integration was limited and data never reliably synced back into the patient chart. They were not built for healthcare, and that shows in the product. Bucket 2, Dialpad and Nextiva. These are genuinely solid phone systems for tech companies and sales teams. They integrate well with HubSpot and Salesforce, but healthcare practices do not run on HubSpot. Dialpad and Nextiva have no EMR integration at all. Patient conversations do not sync back anywhere. If you are running a healthcare practice, I would stay away from both of these. Bucket 3, Emitrr. And yes, I am the co-founder, so you should weigh that accordingly. Emitrr is the only platform in this comparison that was built exclusively for healthcare. We integrate natively with EMRs like Athena Health and ECW. No middleware, no connectors. Calls and texts are present in the same interface. Our AI agent handles missed calls and books appointments directly into the EMR. We are rated 5 out of 5 for customer support, and our onboarding team is trained specifically on healthcare workflows. Where Emitrr is not the right fit. If you are a solo provider who just needs a basic phone line and has no interest in automating anything, there are simpler and cheaper options. But if you have a front desk, multiple providers, or multiple locations, the 5 criteria I just walked through are exactly what Emitrr was built around. Before you get on a demo with any vendor, ask them 3 things. Will you sign a BAA? Is your EMR integration native, or does it go through middleware? What does your support look like at 8 in the morning when my front desk needs help? The answers to those 3 questions will tell you more than any feature list or pricing page. If you found this useful, subscribe to the channel. We keep building videos specifically around AI and operations for healthcare practices. And if you want to see Emitrr in action, head over to emitrr.com and we are happy to walk you through it. Thanks for watching.